is the right of every person who encounters a health care provider or a health system. The treatment may be in an outpatient setting or the inpatient setting. The World Health Organization has given patient safety a critical place in its resolution, its policy, and guidelines. Patient safety is the principal responsibility of the individuals directly involved in patient care and the health facility where the patient is receiving treatment. Hospitals are becoming very complex, and many individuals may be involved in the patient's direct care. Therefore, obtaining relevant information from the patient and communicating all the information regarding the patient is essential for ensuring patient safety. In this video, we will discuss a few scenarios and highlight the patient safety areas. In the first scenario, we will look at a patient who is attending the antenatal clinic for the first time. In this case, the patient's history is significant. Whether the response to each item of the history is positive or negative, it holds relevance for patient management and safety of the patient. Each aspect of the history has information that is important for the patient and includes the patient's full name and some identification that could be a hospital medical record, a mobile telephone, or a national identity card number. The patient's age is of critical importance in obstetrics as it is a determinant of risk. The address indicates patient's social standing, and complete address will allow follow-up if necessary. The presenting complaint and history of presenting complaint is often not given much importance in the first visit for pregnant patients. However, recording and addressing this will lead to patient satisfaction, trust building, and provide information about complaints and expectations. A review of systems will make sure that there is no complaint that is related or not related to the present situation. Past medical history of any illness should be explored to ensure it does not have any relevance to the patient's current condition. For example, if a patient has had a surgical procedure, find out if it was under general anesthesia. If so, was there any difficulty in recovery or intubation? The history should also include information about drug reactions in the past or receiving anesthesia in the past, and any adverse events after or during anesthesia. Ensure proper communication by writing the name of the drug and the dose of the drug properly. Avoid using abbreviations which can lead to miscommunication. When potentially serious drugs are ordered for the patient, make sure that verbal communication is also done with the written communication. If a drug has a sensitivity reaction, then adequate testing should be done before administering the full dose. Medication or drug errors are responsible for many adverse events in a hospital setting. And drug errors mean that a patient is given the wrong drug or the wrong dose. Family history of preeclampsia, hypertension, diabetes, congenital anomalies, breast cancer, and ovarian cancer are relevant to ensure early pick-up of medical disorders. A gynecological history should include menstrual, sexual, and contraceptive history. Sexual history should include if the couple is together since marriage and what is the nature of the job of the partner. There are certain jobs which have high risk of sexually transmitted infections. In conservative societies, it may be difficult to inquire about multiple partners. Sometimes patients will voluntarily ask this question if they have a concern. A simple question may be, do you have any concerns about your sexual life? Talking about contraception allows the opportunity to discuss and educate about different methods of contraception and also to dispel wrong beliefs and wrong ideas. The social history is very important in countries where there is a social support system mandated by the government. In low-income countries, it is a determinant of poor health. For example, low income is equal to high-risk pregnancy. Now we will look at another scenario which is commonly seen in our practice. The patient is admitted to the ward and blood transfusion is requested and administered. Blood transfusions are sometimes required for patient care, and this is an intervention which may be required in an emergency where there are more chances of mistakes. By itself, blood transfusion has the risk of complications. Rarely, severe ones can occur during the transfusion or some days after and can cause morbidity and mortality. Mild complications are seen more commonly and include rash, itching, and or fever. The clinician and the team who should have knowledge of blood banks which are able to provide safe blood. Safe blood means the blood has been taken from a healthy donor, has been properly screened, is accessible, reasonable in cost, and is likely to be provided when needed. The clinician also has the responsibility to take a blood sample from the patient and label it accurately and ensure quick transport to the blood bank. Once the request has reached the blood bank and the blood has been delivered, the clinician then has the responsibility to ensure the labeling is correct and the blood is meant for the patient. A bedside spot check can be done by mixing a few drops of patient blood with the blood from transfusion bag and observing it to ensure no agglutination is taking place. Once the blood transfusion is started, a monitoring schedule should be followed. It is appropriate to use monitoring equipment for this purpose to ensure objectivity. Patient vitals should be documented before transfusion, 15 minutes after the start, and then hourly until the transfusion is completed. The staff involved with the monitoring should be able to identify a reaction, communicate this urgently to the team members, and all drugs should be present and available for proper management. A patient care team in the ward consists of a senior doctor, junior doctor, senior nurses, junior nurses, and sometimes assistants. All team members should be given respect, trust, and proper training to ensure mistakes are minimized during patient care. An important part of patient safety is to make sure that if any error or any adverse event is noted, it is communicated back to the Quality Control Committee to make sure a proper analysis is done so that these errors cannot happen again. We now come to the end of the video, and to conclude, remember there are 5 factors which can help to improve the patient safety in hospitals. Firstly, the use of monitoring technology to ensure objectivity, reliability, and urgent alarm system to alert the team. Secondly, to ensure the patient and the attendants understand the process that is being followed. Next, to verify all procedures by making sure all documentation has been done accurately and has been checked by the supervisor. Next, proper hand washing procedure must be followed before the patient is approached and after completing the procedure. This ensures minimization of the risk of transmission of infection. Thank you very much for watching this video. Goodbye.